There you are.
Thank you, Guy, for the nice introduction, and good afternoon, everybody. It's really great to be here at this Mood Final Conference to present everything we have done with respect to tick-borne encephalitis within the Mood project. So I actually started working as a researcher in the Applied Ecology group at Dartmouth Mac Foundation, thanks to Mood in 2021. And since I started, I devoted my time to this disease. And this is everything we achieved during the past 3 years. So first, a little bit of background. You probably already know about this, but just to refresh our mind a little bit about tick-borne encephalitis. So this is a zoonotic disease that affects the human and animal central nervous systems, and it is widespread both in Europe and in Asia. Within the Mood project, we only focus on the European part of this disease spread. And the virus is transmitted to humans through the bite of infectious ticks, but it can also be acquired through consumption of unpasteurized milk and dairy products that have been produced from infected animals. So as you can see from the bar plot in the bottom, the European incidence of TBE human cases has increased during the past 5 years, and now there are more than 3,500 cases that have been officially reported to ECDC. Not only the numbers of cases are increasing, but also new hotspots are appearing in non-endemic countries. So this disease is posing a threat to European public health. And this is why Mood devoted one specific case study to model this disease risk. So our final goal was to map the European-wide probability of occurrence of human TBE cases, and we also aim to do this at the highest possible spatial resolution. So how did we do this? Well, this is the workflow of everything that we did. So first we had to collect data, of course, and we obtained the official data from ECDC upon agreement. And so we received this really great case-based data set spanning 6 years from 2017 to 2022. And we then coupled this epidemiological data set with covariate data. But first, we had to understand which are the covariates that actually drive this disease. And to do this, we performed an extensive literature review and a statistical analysis to identify the most important drivers. And the results are presented into this paper that we published in Eurosurveillance in 2023. And I will also tell some more details later on. Then we applied a machine learning model, a boosted regression 3 model. And using this model, we managed to obtain 2 different kinds of outputs. First, the probability of presence of human TBE cases at the regional level, but then we also downscale the results at the municipal scale to try to have a higher understanding of what is happening with respect to TBE cases in Europe. And this is just a brief overview of the data set we built based on the cases that we obtained from ECDC. So we had this case-based data set with more than 13,000 cases. And we transformed this data set into a presence-absence one from 2017 to 2022. And this is the data set that this model has been trained on. Then we also had to understand which are the covariates that drive the disease. And we screened lots of articles and finally extracted data from 62 papers. And as you can see from the graph here, most of the articles have been published after 2010. So this actually reflects what we also noticed with respect to TBE cases since the disease is actually growing in the last decade. And the results of this paper has also been translated into what was our first Mood output, because we noticed that it was really difficult to understand these big Excel files that we produced after the literature review. So we decided to try to translate these outputs into a dashboard, and this is part of the Mood platform, so this can easily be accessed. And here you can find all the results of our literature review, so all the covariates that have been used in literature to model TBE. And this is free, and you can access it from the Mood platform. So based on the covariates that we found from the literature review, we applied our boosted regression 3 model. And here in this slide, you can find a summary of the 6 most important drivers that we obtained after our modeling approach. So I'm sorry that there are some problems in the slides, maybe. Okay. No, it's okay. Yeah, okay. No, because I said, okay. So I know it's a little bit packed, but we don't have to go into the details here. Just to show you that the most important drivers were related both to the natural hazard of the viral circulation of TBE in the environment. So we have the presence of key animal hosts, such as rodents and deer. And this was a really important covariate that has been originally produced by our colleague Willy Wint and can also be found in the platform. And then some other drivers related to the forested areas, the precipitation, and also the autumnal cooling rate based on temperature. And one important addition that we made to our model, since it is focused on human TB cases and not just the viral circulation of the environment, we also included exposure drivers to have proxies for the likelihood of encounters of humans with infected ticks. And 2 drivers have been selected as the most important: the density of forest roads, which is a proxy for accessibility to forested areas, and actually is a good driver for human exposure to tick bites, and also population density. And last but not least, these are the maps that we produced. So you can see them here in form of GIFs, but they are also easily accessible on the platform. So if you go to the Mood platform, you can zoom in the areas and see what's happening here. And we can see that the highest probability of presence of human TB cases are in Central Eastern Europe, but the probabilities are also shifting westwards and northwards. And to better explore what might be happening here, we also try to look for trends in our predictions. And we applied linear regression models to each specific area and see if we could find any increasing or decreasing trend. And here in this map, we only mapped the significant coefficients of these models. And the red ones are the areas that showed an increase. So we can also see here from these outputs that there is an actual shift from westward Europe. And this is something that has also been reflected in the cases that have been reported to ECDC. So this is, let's say, a good confirmation of the fit of our model. And also it highlights how important it is to look into this disease, because also due to future climate and land use changes, the disease might shift even more. So finally, to wrap it up, some final remarks. So we built this tool within the Mood project to support surveillance and preventive measures of this disease. And this was actually built with co-conceptions of end users and ECDC and public health institutes. And what we did here was not only to consider covariates related to the hazard of viral circulation, but also human exposure to tick bites. And the model predicts the probability of occurrence of human TB cases on a yearly basis. So we will update this output from year to year before the beginning of the questing season. So probably around February or March. So this model will be regularly updated. And one limitation of this study is that we didn't have vaccination rates for all the regions and all the countries, so we could not include that aspect. And that is why we only modeled the presence of TB and not the actual number of cases or the incidence, because without knowing the actual vaccination rates, that was unfortunately impossible. And lastly, some possible use of this model is that it can be used to identify specific areas, also for sampling in research projects, because it gives an idea of where TB cases might appear. And also it can be useful to public health practitioners to select in areas where surveillance could be strengthened and prevention programs applied. So finally, I would really like to thank all the colleagues that contributed to this work. My colleagues in my research group at the Mac Foundation, Anna Paola Rizzoli, Giovanni Marini, Valentina Tagliapietra, Daniele Dare, and all the amazing colleagues that I've met during Mood. So thank you very much.